Hello and welcome back to Mission Ready Body. I am your host, Dr. H, physical therapist and veteran, and today's episode is a Patreon member request on lupus. So, let's dive right into where it is. Actually, first, shameless plug. Yes, Patreon exists. Yes, there are free options. Yes, there are paid options. Yes, you should join and become a part of the dynamic and growing community. All right, shameless plug over. Let's be upfront about this episode. Lupus is one of the conditions that I see where veterans, especially women of African descent, get passed around the medical system. They can be told that their pain is vague or unexplained. They never really get a clear picture of how physical therapy is supposed to help them. And once they do finally get a physical therapy referral and they get sent out into the economy where I see them, they don't always know what to ask for, what to expect, or if what they're experiencing is normal. So today is going to be about addressing all of that for anybody and everybody who has lupus. So that means it's on you to send this to somebody that you know that has lupus to help them better get educated about their condition. This is not going to be a medical lecture. It is not going to be medical advice. You should go and talk to a doctor if you think you have this condition and to be cleared for exercise. This is me sitting across from you, getting coffee. I'm literally sipping on a cup right now, explaining what's happening in the body and how physical therapy can and may not be able to help. So that way, when you walk into the clinic, you have a more empowered conversation with your physical therapist. Because here is the truth: a physical therapist can only help you as much as you help them understand what you're going through. So that starts with you knowing your own condition. So let's get into it. Lupus in plain language. What is happening? Well, what is lupus? Why is it making your body feel the way that it does? Lupus is an autoimmune disease. The simplest way I can explain this is that your immune system is supposed to be attacking threats to your body, like viruses, bacteria, anything foreign. Unfortunately for me, that means allergies. But in lupus, the system gets its signals crossed and it begins attacking your own tissues, thinking it's the enemy. This means your joint, your skin, your organs, your muscles, all of them become targets of your immune system. It's friendly fire. Your defensive system is working hard, but it's aiming at the wrong target. Now, lupus is what's called a systemic disease, meaning it doesn't pick one spot. It affects the entire body. It is systemic. That's why lupus can look so different from person to person. One person may have mostly joint pain, another has skin rashes and extreme fatigue, one has kidney involvement, the other one doesn't. Well, not as much. Most of the time it's kidney involvement. But the common thread is inflammation, runaway, misdirected inflammation. And for veterans especially, this is also true for a lot of people that work in manual labor occupations, there is something important to be understood. The physical and the psychological stress can be contributing factors in autoimmune conditions. Environmental exposures, chronic stress, extreme physical demands, all of these can influence how the immune system behaves over time. If you've been told your symptoms started or worsened after service, that's worth paying attention to, but I'll come back to that later. The symptoms that matter most for physical therapy, what are they? The big ones are joint pain and stiffness. Right out the gate, these are the biggest ones. They affect somewhere around 90% of people with lupus at some point. And this is not just soreness, this is a deep aching pain in multiple joints, worse in the morning and worse after rest. Your hands, wrists, knees, and feet are all the most common sites. You might even notice that your grip is getting weaker than it used to be, or that opening jars, buttoning up a shirt, carrying a gallon of milk, etc. all has gotten harder, and it's not just inside your head. Next is fatigue. Lupus fatigue is not regular tiredness. It's not something you can push through with more discipline or another caffeinated beverage. It is a profound, systematic exhaustion that is partly caused by your immune system being in a constant state of inflammation, but it can also be due to anemia and other things. Patients consistently rate fatigue as their most debilitating symptom because a lot of the times it's the one that keeps them down. Most people find a way to try and manage with the pain and keep doing life, but once you've been hit with the fatigue, you're out. A physical therapist needs to understand this, and we're going to talk about how we need to communicate it. Next is muscle weakness. Some people with lupus develop what's called, well, they develop actual muscle inflammation. I won't bother you with the boring scientific name. Many more develop muscle weakness just from being less active because of the pain and fatigue. Either way, due to the actual targeted muscle inflammation or the lack of use, especially around the hips and the shoulders, it ends up affecting how you walk, how you carry things, how you get up and get down from the floor or from your couch. Next is brain fog. This doesn't show up on a movement screen, but it will affect your ability to follow instructions. Believe me, patients already don't know how to follow directions. Um, Add in some brain fog, and you're working a little bit overtime. You're working harder than other patients have to. This is also true when it comes to a home exercise program or a gym day and keeping yourself engaged and knowing which exercises you should do next. If it's real, it needs to be documented. Well, sorry, it is real and it needs to be documented. So when you're feeling it, bring it up to your physical therapist. Finally, flares and remission. And this is the most important thing about how lupus works day to day. It fluctuates. I'm sure anybody who has this condition can tell you that. There will be weeks where a patient can feel relatively good, and then there will be flares, periods of time where everything feels like it's getting worse. This can be pain spikes, fatigue crashes, joint swelling. Understanding that things fluctuate and that the body operates in a cycle is going to be fundamental to how physical therapy should be approached. So, why physical therapy? What can physical therapy actually do? This is the question that I want to answer most directly because I've had veterans tell me, my doctor referred me to PT. I don't know why. I thought this was just a medication issue. And this is something that's true not just for lupus, but for a wide variety of conditions. Here's the thing for lupus. Medication manages the immune system. Physical therapy manages what your immune system has done to you. Those are two different problem sets, and they require two different solutions. In my opinion, every patient with lupus could benefit and needs to benefit from both. So let me break down the specific things PT can address. And again, all this is predicated on what you and your doctor have talked about what's right for you. Getting your movement back. Lupus joint pain makes you guard. That means tensing up and bracing and trying to restrict movement. The only time that someone stops guarding a joint is after they've learned that it can move without causing pain. But before that happens, most people stop using the joint because it hurts, and that allows it to stiffen up. So it becomes a little bit of a vicious cycle. Because the muscles around it get weak from disuse, and now there is a mechanical problem that exists on top of an inflammatory problem. Physical therapy is literally designed to treat these sorts of conditions because it targets the mechanical problem. It works to restore range of motion, reduce stiffness, and to get people moving as normally as possible again. It also does this by helping build strength. Between the disease itself and the medications, and we'll talk about the steroids, for example, in a minute, reduced activity from pain and fatigue leads to significant muscle loss and strength over time. That weakness has real world consequences, which turns into difficulty getting up from a chair, difficulty climbing stairs, having a hard time carrying groceries, having a hard time doing your job. A physical therapist can design a progressive strength program that is specific to your limitations and safe for you. Now, one thing that I kind of touched on earlier is lupus can present differently in different people. There's no one size fits all treatment for lupus as a physical therapist because your limitations are specific to you. You might have specific range of motion limitations that another person doesn't have, which is why the physical therapy for you will look different. Managing fatigue. There is a technique called pacing that physical therapists can teach, and it's one of the most powerful tools for managing lupus fatigue. Pacing is the strategy of distributing your physical energy throughout the day so you don't hit the wall. Doing activities in a planned interval with rests built in, rather than going as hard as you can until you crash. Yes, this sounds simple, but the sad truth is most people are not taught. A good physical therapist should be addressing this with you and teaching you pacing. Next, exercise as medicine for the disease itself. And I know this might sound counterintuitive. If your body's exhausted and it's inflamed, why would a physical therapist be interested in exercising? The research answer is that regular, appropriately dosed exercise has been shown in multiple studies to reduce lupus-related fatigue, to improve mood, to improve cardiovascular health, and it does not worsen the disease activity when it's done right. Appropriate dosing, appropriate exercise actually helps regulate the inflammatory response over time. The operative phrasing here is done right. I am not talking about going and doing a CrossFit challenge during a flare. I'm talking about walking, swimming, cycling, and resistance exercise with appropriate modifications. That is where the physical therapist can shine because it is their job to figure out the right dose with you. Protecting your joints. For people with hand and wrist involvement, physical therapy includes joint protection education, how to move, how to lift, and grip strength in ways that reduce stress on the inflamed joints. Simple things like how to open a door, carry a bag, type at the computer, heck, even play video games. These can all be modified to significantly reduce the daily pain load. And then finally, and arguably most importantly, especially for the elderly, helping you not fall. Lupus affects balance through muscle weakness, sometimes through nerve involvement, and often through the side effects of medications. Falls are a real risk that can lead to real injury. And as we know, when people get older, in the aging geriatric population, a fall and fractured hip can lead to, it can lead to early death. Balance training is often a good part of PT because it helps people with lupus maintain or improve their balance and preserve their safety while they're trying to do activities throughout the day. So now let's talk about steroids, what your meds are doing to your body. I want to spend a few minutes on this because it's something most patients are never told directly, but it is relevant to your physical therapy care. Corticosteroids, such as prednisone, being the most common one, are a go-to medication for managing lupus flares. They work by suppressing the immune system and reducing inflammation. In the short term, they can be a lifesaver, but long term, they come with a significant trade-off to your musculoskeletal system. Here's what long-term steroid use does to your body that your physical therapist is going to care about. Muscle wasting. Steroids break down muscle tissue over time, and this causes weakness, particularly in the large muscles around your hips and your shoulders. I keep talking about those for a reason. They're the ones that seem to get most affected during lupus. If you've been on steroids for months or years and you're noticing it's harder to get up from a low chair, to climb stairs, or reach overhead, steroids could possibly be contributing to that condition. Targeted resistance training is actually one of the best ways to counteract this. Bone loss. Long-term steroids can accelerate bone density loss and significantly raise the risk of osteoporosis. This is an issue, especially on top of the balance issues already, because it means that you are now at an increased risk of fracture from falls. Weight-bearing exercises and resistance training are protective against bone loss, and it's another reason why physical therapy is an excellent choice for this population. It isn't really optional in my opinion. everybody should be doing resistance training if they've been cleared to do so, because it does help protect the bones from losing their density over time. Next is avascular necrosis. This is a less common, but a very serious complication from the steroids. Long-term steroid use can compromise blood supply to the bones. Most often, this is the head of the femur. That's the ball at the top of your thigh bone that's in your hip socket. When the blood supply is disrupted, the bone tissue can die. And this causes hip pain, groin pain, pain and difficulty with walking most commonly. If someone has been taking steroids long term and they begin developing new hip or groin pain, that needs to be brought up to the physical therapist, because the physical therapist can assess the joint, and a lot of the times they can recommend for imaging before they start aggressively working on that hip, because imaging, x-rays, MRIs, etc. are going to be what reveals if there is avascular necrosis. So, one other thing that you should talk to your physical therapist about is what medication you're on and at what dose, how long you've been taking it, any recent changes in your dose, such as it recently went up or recently went down, and any other medications. The physical therapist doesn't have to have the education of a pharmacist, but just bringing your medication to explain to them will help them look them up and see if there's any side effects such as dizziness or balance issues to help them better treat you. So, how to talk to your physical therapist. This is the heart of the episode, and I want to give you a practical framework for communicating with your PT so you can actually get the care that's right for you. Before your first appointment, prepare these 3 things and you will save yourself 15 minutes, I guarantee it. Your diagnosis history. When were you diagnosed? What organs or systems are involved? Who is your rheumatologist? Bring their contact information, and a good PT will probably reach out and communicate with them. 2, your current symptom picture and your system picture. Not just I have pain, but where specifically, with what joint, when, and what does it feel like? Is it aching, burning, sharp, numbness, tingling? When is it worse? When is it better? Is it worse in the morning or the end of the day? Is it worse after activity or after prolonged rest? What is your fatigue looking like on a scale of 0 to 10? 0 is not that bad, or it's really none at all, and 10 is the worst of your entire life. And are you in a flare-up right now, or are things relatively stable? I'll also add, when was your last flare-up? 3, your goals. What do you want to be able to do that lupus is currently getting in the way of? Is it walking a mile? Is it keeping up with your kids? Is it returning to a very physically demanding job? Is it staying strong enough as long as you can to avoid losing function? Is it to prevent a fall? Being specific is going to help. Saying, I want to feel better is not going to help your physical therapist know what they can do to help you get better, because getting better is a very nebulous term. Saying, I want to be able to walk from this spot right here to the parking lot without getting out of breath, that's something a PT can help you work towards. Other things to say in your first PT session. I have good days and I have bad days. Today is a fill in the blank sort of day. This will help you set the tone with the session. If you walk in and say, today is not a good day, and I had a couple good days last week, so this is just not one of them, that's going to help your PT immediately know if they're going to adjust whatever exercises they were getting ready to do and say, oh, today's not a good day, let's scale everything back, instead of trying to run you through the same exercise and progression. Your symptoms change, which means the PT should change. You can also tell them things like, hey, my fatigue today is just as much of a problem as my pain. That lets the PT, again, adjust their plan and implement more pacing, implement more rest breaks. Because remember that fatigue is often a bigger barrier to function than just pain. So saying today is a day where my fatigue is at 8 out of 10 is definitely going to help a PT scale things that is appropriate for you. Saying something along the lines of, hey, last time I crashed because I feel like we overdid it, that's important. The PT needs to know if they pushed you too hard and that you were down for a day or two and you need to recover. That's not weakness, that's physiology, and the physical therapist needs to know how to appropriately dose you. You can also say things like, hey, I'm not really sure if this is pain or if it's a flare up or is this regular soreness. That starts a good conversation because the PT can sit down and say, hey, this is actually muscular soreness. We expect you to feel this way, or hey, this was not what we were expecting to happen. This sounds like it's not really just normal soreness, it could be something else. Another thing you can say, here's what I was able to do before I got sick, before I got diagnosed with lupus, because it helps your physical therapist find a baseline that you had prior to this event. Now, this is also true if you're coming in for the first time and you're in the middle of a flare up. You can tell your PT, here's where I was before I had this flare up. Again, it's all about showing your PT where you were at baseline before things changed. Veteran patients, especially in my experience, they need to tell me their history because once I understand what their specific occupation required from their body, I can see what their fitness level was and what they lost. And then I can be realistic about what we're probably going to get out of PT in terms of getting back to where we were. Questions that you're going to want to ask your physical therapist. Is what we are doing today appropriate for where I am at with my disease right now? Sometimes it's a long day, and just asking that question helps the PT pause and go, that's a really good point. I was going to try and push you today, but you did say that your fatigue is like a 6 out of 10, so maybe I'm pushing you a little bit hard. Another one, how are we going to know if what we're doing today is too much? Again, the PT can say, okay, well, I'm expecting you to be sore, but I'm not expecting this. But hey, what is your fatigue level again? Again, all you're really doing is driving conversation and communication. Sometimes you're going to have a PT like me that probably talks to you too much, asks you too many questions, constantly cues you and says, hey, where are you feeling this? How are you feeling this? Are you tired? Where do you feel tired? Do you feel achy? How do you feel achy? Hey, I noticed your knee moved a little bit too much there in that intervention. What was going on there? I'm very hands-on, very hovering right around my patients, analyzing everything they're doing. Some PTs are more standoffish and they watch from a distance. If you feel like you need to drive that conversation because it's going to only improve your care and that PT's ability to help you because by communicating more to them, they're going to get a better picture of what they can help you get back to doing and what that day's session should look like. Things you could also say is, hey, what should I do if I have a bad flare-up? Should I skip PT or should I come in anyway? Will we be able to scale things back for me? Or should I just say, hey, I'm calling it quits for the week. I'll see you after the flare-up is over. Other things you can say is, hey, can you reach out to my rheumatologist and ask them X, Y, or Z? That just drives a conversation between you and the PT, or they say, hey, actually, that's not my lane. That's what you should be doing. Or they can say, hey, actually, yeah, let me reach out to your rheumatologist. You did just change your dosage. Let me tell them what I'm seeing. Again, all it is just doing conversation between all the different medical professionals to make sure you are getting the best care. The last and most important question is, what is my homework exercise plan? Because that last question matters the most because lupus is managed over months and years, not during clinic hours and not just during days or weeks. It takes a long time, and a good home exercise program is a huge part of the equation. What to do if the physical therapist isn't getting it? Unfortunately, sometimes you are going to encounter a physical therapist who will treat you just like everybody else. And that's unfortunate. But that's also not what's right for a lupus patient. And you have the right to say, hey, I need to slow down. I'm worried that this is going to cause a flare-up. You have the right to ask for a different approach and say, hey, I don't think that what we've been doing these last few sessions is helping me get to where I want to go. You have a right to ask for another physical therapist who might have more experience with an autoimmune condition. These are all your rights, and you shouldn't feel embarrassed or ashamed asking these questions. Now, if you're a veteran and you're in the VA system, you can request a physical therapist who has experience with rheumatology or more arthritic conditions, or even just more complex chronic conditions. They'll probably understand dosing a little bit better than someone else. I work in an outpatient ortho setting. I work with a lot of athletes. I've been able to work a little bit with people that have chronic conditions, but when I was a student working in the federal system, there was a host of different conditions, and I got a little bit of experience at working with people with chronic autoimmune conditions. But calling and asking a clinic and saying, hey, do you have any specialists that are known for working with lupus patients? That is always a good idea. One of the other things you can do, keep in mind with the VA system, is you can always request community care to get the right expertise if it's not available at your VA facility. So, the veteran piece, the service connection and advocacy. Lupus can be service connected. That means if your lupus developed during or was aggravated by your military service, you may be eligible for some VA stuff. This matters because it affects your access to care, your financial resources, and how aggressively the VA prioritizes your treatment. This includes like environmental exposures during service, which is often from burn pits, contaminated water, chemical agents, etc. If you're deployed and developed lupus or had a significant worsening after that service, the connection is probably worth exploring, and you can talk to VA about that. And you can also, I think there's a whole bunch of different organizations out there that would probably love to sit down and talk to you about those things to help you get the care that you need. For example, some of those organizations would be like a veteran service organization, DAV, the VFW, American Legion, or any free VSO. And that's usually available through your regional VA office. They can help you file a claim. You are going to need your documentation, your service records, medical records, etc. All of that's going to be up to them and to you. I just want people to know that that is a possibility for them. So why am I bringing it up? Because service connection affects what care you can access. I'm not just bringing it up for the sake of bringing it up. Getting the connection to military service can get you better care, and better care is what people need. Comprehensive VA healthcare coverage means more PT visits, more specialist access, and potentially community care options if the VA can't provide what is needed locally. That's care that was earned, and it's not something that should be left on the table, in my opinion. Now, finally, and most importantly, at least for this segment, it's something I talk about all the time. Military culture, and also a lot of times hard labor occupations, there's a physical culture. You're trained to push through. You're trained not to show weakness. You're trained to keep moving no matter what. Lupus doesn't care about your training. It will force you to stop. And for a lot of veterans, that forced stop feels like failure and it feels like surrender. So I'm going to say this directly. Adapting to a chronic illness is not quitting. It is not surrender. It is not failure. Modifying your training is not a sign of weakness or regression. What it is learning to work with your body in a new reality instead of working against it. But it is the hardest and it is the most tactically intelligent thing you can do. Your physical therapist should be a partner with you in this. They should help you redefine what performance and strength mean in the context of where you are at now. Not what you could do when you were 22 and in basic training, but where you're at now and what you can build toward tomorrow. Progress is still progress. 1% better every day is still 1% better every day. Function for as long as possible is the goal. So your takeaway. Before I let you go, let me give you something you can use. Here is the checklist for your next physical therapy appointment if you're able to go to one. Your full medication list, names and doses, your rheumatologist's contact information, a brief summary of what joints, what kind of pain, what fatigue level for that week, and your goals, the specific goals that are functional and real life applicable. things that you should feel comfortable saying out loud. Today's a good day, or it's an okay, or it's a rough day. My fatigue is a major issue, it's not just my pain. I tend to crash if I push too hard, and pushing too hard looks like this. Can you help me build in an appropriate recovery? And also, here's what I was able to do before lupus began limiting me. Things to ask. Is this a program that's appropriate for my current level of activity? Can you coordinate with my rheumatologist? And what are my home exercises for the days that I'm flared up? And remember, you can always, and I would say you should, ask for a physical therapist with autoimmune experience. If there isn't one at the clinic that you're trying to go to, oh well, at least you tried. You can also call around to a few different clinics and see if anybody there has that experience. You can always ask to slow down or stop if something feels wrong. You can always ask for community care if you're trying to go through the whole VA. And if you think that your lupus is service connected, that probably is something worth contacting a VSO and exploring. That's a wrap on today's episode. My goal was simple. I wanted to walk you guys through what your next physical therapy visit could look like, or if it's your first time going to physical therapy, how you can have that conversation with the physical therapist. That way you can provide more education on your body, your fatigue, where you're at. You can know what to ask for, and hopefully you walk away now knowing that you deserve more than generic care. Lupus is a hard condition to live with, but you don't have to live with it passively. The more empowered you are by understanding what's happening, the more clearly you can communicate it, and the better your team can serve you. So hopefully that has answered a lot of your questions. If you have any other questions, I can always do an addendum to this episode. Heck, I might even be able to get some other medical professionals to come in and do their own addendum. But feel free to leave a comment or a question, and definitely share this episode with someone that you know that has lupus so that way they can get better informed and educated about not only the condition that they have, but how physical therapy could benefit them. So as always, stay happy, stay healthy, stay fit, and stay awesome. And I will catch you guys in the next episode.